Good morning, everyone. So today I'm going to be starting a series of lectures discussing the top homeopathic medicines we use in this clinic that are natural, have no side effects, are not addictive. The majority of the time will address the problem that's at hand, and the benefits remain even once the medicine is finished. So these are the benefits of it, but we're going to be talking about the top medicines to help in the recovery of autism and the symptoms of autism with the children we see here. Now, I want to make something very clear. When it comes to autism, homeopathic medicine does not cure anything. It does not treat anything. Homeopathic medicine is very simply the stimulus, a very specific chosen stimulus to get the child's body to do the healing itself, essentially, is what happens, okay? So let's talk about a couple things. I want to talk about one of the main medicines we use. The name of the medicine is called stramonium, okay? Now, this medicine, what we look for when we're treating delays or autism, we look for a couple things. Now, every medicine or a lot of medicines will cover the main complaints of autism, okay, which is typically parents usually come to me. It's hand flapping, you got the stimming, a lot of times they're nonverbal, the social cues aren't there, the eye contact's not there, sometimes they're violent and aggressive, so on and so forth. So these are common, a lot of times common symptoms of autism, okay? A handful of medicines already have that. Now what we look for is that in a medicine, and we look for the finer details of this medicine that are present in the patient that's complaining with the symptoms of autism, okay? So we're going to talk today about stramonium. Now stramonium is, this medicine is used very successfully here for the majority of cases. Now obviously, I have to say this because of a regulatory board, but obviously there's no guarantees of anything. You can never guarantee a treatment's going to work for every child with these symptoms, okay? But I could just talk about what was done in the past here at the clinic, okay? So typically what we see with stramonium, you will look for a couple things. So you'll have the typical, like I said, stimming. There'll be lack of communication. There'll be lack of eye contact. There'll be lack of social skills. They could be verbal or nonverbal. But you have the typical symptoms of autism. Now, what we look for to prescribe this medicine, and typically when we prescribe this medicine, not in all cases again, but you will see improvements in these kids fairly quickly. Slow progress, but usually within the first 7 to 14 days. Every case is unique once again. We look for extreme fear of the dark, okay? So with these kids, what will happen is as soon as the lights go off at nighttime, they're extremely scared. They're terrified. They need someone to sleep with them. They need someone by them all the time. They do not like to be alone at nighttime with the dark. So that is a huge factor for an indicator of this medicine in the symptoms of autism or dealing with the symptoms of autism. Number two, we like to see, typically these kids, they will be extremely scared of animals. So I'm talking about abnormally scared of animals. Every kid will have a little bit of fear of a new animal. But I'm talking about seeing, typically dogs is what they're usually scared of. And they will see a dog across the street. It will be on a leash. It will be a small, tiny dog. And they will get so terrified, they run from their parents. They hide behind their parents. And they need to be picked up a lot of times off the ground because of this fear. So this is an extreme fear, especially of dogs in these children, is a key indicator for the medicine stramonium to help with the recovery of autism in these kids. The third thing that we almost always want to see to prescribe this medicine and to help with the symptoms of autism is we like to see violence. So the kids that need this medicine are typically they can be, or they have been in the past, very violent children. So this includes violence to animals. You'll see them, when an animal, instead of petting an animal like a cat or a dog, they'll kick the animal. They'll try to sit on the animal. They'll try to pull the animal's tail. They get very violent with animals. Smaller animals, you'll find them killing smaller animals like frogs or whatever, little small animals. So they have a violent tendency towards them that they can't help. It's just a part of their symptom complex of how they present with autism, because every case of autism is unique and presents with little subtle symptoms that separate one case from another case, and in turn dictate different medicines to help that person and that person's immune system heal from the symptoms of autism on their own, okay? So once again, we have and with the violence, obviously there's the violence of animals, but we get the violence everywhere. These will be the children that will tend to bite kids all the time at school. These will be the children that will throw things at parents or at other children when they're angry. They'll throw toys. They'll throw they'll throw chairs. There's a lot of violence in this picture, okay? The fourth thing that I like to say, and it's seen sometimes, not all the times, but they tend to have a lot of twitching or spasms, especially when they sleep. So you'll see it could be in the form of grimaces, like what we say grimaces. So you'll see the face, they'll make funny faces, they'll scrunch their faces, almost like they're having spasms in their face. That's common. You'll see twitching and spasms of legs and arms, etc. It could be any part of the body, but especially at nighttime during sleep. So that is what we look for when we prescribe this specific medicine called stramonium in a case of autism to help the child's body recover by itself. Essentially, we stimulate the child's immune system to start recovery of autism on its own. We don't do it. The medicine doesn't do it. The medicine is simply and solely a stimulus to help that child, to kind of unlock that child. Okay? So let's recap. For stramonium, what we typically look for, the typical symptoms of autism, we have extreme violence towards animals and towards other people. We have extreme fear of the dark, like I'm talking extreme fear of the dark, and they cannot be alone in the dark. They need someone there all the time. And number 4, we got the violence, we got the extreme fear of the dark, we got that, and we got the fear of the dogs, the fear of animals also, but especially dogs, black dogs. Doesn't matter the size. It's an extreme reaction to dogs in general. So that is just a quick little overview I wanted to give you guys on stramonium. It's used very commonly in this clinic, and typically when the medicine is properly dosed and given in proper form with the proper dilution, we do see good healing responses in these kids. Once again, I have to say, because of my regulatory board, every case is unique. Nothing can be guaranteed, but a lot of these kids will react greatly to this medicine if the symptom picture calls for it. Their unique symptom picture of autism, okay? So anyways, I never recommend you guys give this medicine. I mean, you can buy this medicine on your own, but I never recommend you give it on your own because homeopathy, even though it is safe, if you give too much of the correct medicine, existing symptoms can get a lot worse, and I mean a lot worse. So homeopathy is a balancing act, giving the right medicine in the right dose, in the right frequency, in the right strength, enough to cause a healing response within that child, so we see positive things, but not too much to cause aggravation. So it's a very fine balancing act with these kids. So if you have more questions, give me a call here at Leaf Homeopathic Family Medicine. We deal solely with children on the spectrum, and we deal with a lot of delays with kids. So if you have any questions, give me a call. We'll take 15 minutes. I'll listen to your concerns. I'll explain how this process works. And I can tell you guys how most likely we will be able to help, okay? So this is number 1 of a series of medicines we're going to be going through that we tend to use at this clinic. Their indications, and then kind of gives you guys an idea of how we do this, how it works, and then what you can expect, okay? Give us a call.